mean something like me.
Action. Okay. Nice to see you, Randeep.
Nice to meet you.
Thank you for joining.
Of course.
We've got the CEO and founder of A&R Priority Healthcare. Did I say that right?
You like that?
AKA Dr. Bella. He's the man that you call when you've got an issue and you need someone to turn up to your house and fix it for you, right?
Absolutely, yeah. So we sort of provide a sort of bespoke, sort of personalised healthcare service to you at home, basically.
Nice.
So you can age well in the comfort of your own home, and we sort of look after you and take care of everything.
Amazing.
So yeah.
And there's a sort of funny story as to how we met. So you're in Oxfordshire.
I'm indeed, yes. So
How long have you been in Oxfordshire?
for the last 10, 12 years. So I sort of came here for my GP training in Oxford.
Yeah.
And then we've kind of based here and sort of stayed here since. Really.
Yeah.
So it's a pretty nice place. So we really enjoy it. So I've been here for a while now.
Yeah, nice. And remind me how this happened. So you kind of contacted me saying, oh, actually, hey, you guys are there, which I thought was great.
Yeah.
We need this. You know?
Okay, so I think what happened was I came across your sister Cam on LinkedIn.
Yes, yeah.
So me and Cam started talking, and then my wife Emma realised that is Walfinch, and she goes, I think I know someone at Walfinch. He used to go to university with you. So it turned out Amrit and my wife Emma went to uni together in Kiel, wasn't it?
Yes. Million years ago, yes.
But it's a small world. So that's how we put up linked up. So we sort of been in touch since.
Yeah. Oh, how funny. Yeah, that's it's a very small world. But,
Absolutely.
But thank you so much for joining us.
Of course. Yeah.
You know, one of the things that I have a huge passion about is aging well, and I think the older population in the UK are sort of forgotten, and also I think right now we're in a space where wellness and aging and exercise and productivity all sort of loop in together. I start my day today at 6 a.m. in the gym because it just gets the endorphins flowing and you punt for the day and all of that. And I've always felt, I'm sure there's studies on it, that the productivity level increases with all of that. But
Indeed, yeah.
But I wonder, I really want to kind of dig in today with yourself and,
Yes.
if I'm a 50-year-old and just thinking about, I'm thinking about the next phase, and thinking, how do I age well? What are the things that I need to be doing?
Yeah.
What are your kind of, your top hacks there?
Yeah, so I think the first thing about aging is we want to be, as you're saying, aging well, is the quality of life, not just aging. So I think things you can do in your 40s, 50s, or 60s, it's sort of, one of the main things is getting like a health MOT done. So, we take a car every year for an MOT.
Yeah.
Where the car gets checked over. And actually, we should do the same for our health as well.
Yeah.
So, any chronic problems you have get taken care of and monitored. And any new things are identified. So, for example, on an annual check, one you always look for is things like your blood pressure, your weight. You do some blood tests, make sure things like your cholesterol is okay, things like your sugars are okay.
Yeah.
So identifying any problems that may occur and actually getting hold of them properly and quickly.
So Health MOT is, me going in and someone sort of literally doing blood tests on this, is this? Not me on a treadmill like one of the Bond movies to make sure that we're okay for battle.
I think if obviously something turns up in the Health MOT where we think actually there may be some sort of cardiovascular risk factors or something, then we can go further. So then we can do targeted cardiovascular investigations, like on a treadmill, and see what your heart's doing on the treadmill. Is it coping? Is it not coping? Or are there any problems there?
Yeah.
So the sort of the Health MOT screening sort of identifies anything early.
Yeah.
So then you can take care of it and get on top of it, really.
So that's really interesting. So in the ideal world,
yes.
How old would someone be when they start doing this?
On the NHS, they offer a sort of a NHS sort of well-man check or a well-person check at 40.
Yeah.
And that's it. So then after that, I think it's every 5 years they're offering it. But actually, starting at 40 and doing it annually is absolutely fine.
And you think doing that sort of from 40 is a sensible place to start, and you've got some benchmark data for it.
And then you've got sort of, and it always gives you a peace of mind as well that I've had my health looked into, everything looks okay, the things that are important. I think things like your cardiovascular health, your blood pressure, your risk of stroke, heart attacks, heart disease, risks of cancers, all those sort of things.
Yeah.
And it always gives you a clean bill of health. You carry on, keep focused, do your exercise, keep well, and keep your things like your nutrition and wellness up as well.
Yeah.
There's lots of research that we're doing at the moment that's coming into actually supplements and minerals and nutrients and those things that are important in your 40s or 50s that sort of improve focus, cognition, delays things like Alzheimer's or dementia and things like that. So, making sure we're keeping up to our omega fatty 3 acids, your vitamin D levels, magnesium, zinc, NAD. So all of these things are really, we're finding more and more about it.
Yeah.
So it's not just about just not about sort of medical therapy. It's about wellness and holistic therapy as well. And actually, how can we sort of increase our overall well-being with these sort of things?
Very interesting. So thinking about dementia and Alzheimer's, I think that's a really interesting space to, what can we be doing in our 40s and our 50s that will help prevent that later?
I think sort of nutrients are really important. So making sure your vitamin D levels are topped up, making sure your fatty acids are topped up. So things like, oily fish and things like that, or even supplements. Making sure your levels of magnesium and zinc are on the higher end as well. Helps with brain function and cognition as well. Things like keeping in touch with your blood pressure and things like that. So if your blood pressure is under control in your 40s and 50s, that delays or prevents the onset of problems in the future with your brain base. So all of those things are preventative. Those are things that we can, that we take care of in our checks annually to make sure those levels are kept up. And actually social interaction, going to social groups, going out, meeting other people, learning new skills, playing an instrument or something like that. That all helps both boost your focus and boost your cognition as well. So all of our clients, we always make sure every time we meet, talk about things. What are the interests? What can they do?
Yeah.
There's always something you can do, even if you've got disabilities, even if you're, can't do many things. There are always things you can do to keep your brain going, keep your cognition and your well-being going.
Yeah.
And I think one of the things is getting to know your patients. So I think, unfortunately, in the current NHS climate, it's so busy that you can't really get to know your doctors. Doctors are changing. You're seeing pharmacists, paramedics, nurses. You don't actually get to build that bond and that close relationship, which in the old days they used to have. And I think that helps you to confide in someone as well. So, a lot of times people hold on to the symptoms because they think, I don't want to bother the doctor, they're busy or whatever. But actually having a close relationship with your doctor helps with that as well. So there are, certain key things that we would always say, make sure you tell your doctor and not hold on. So, for example, things in your 40s or 50s to watch out for would be any change in your bowel habit, any change in your urine, especially with prostate cancer and PSA and all those things that are coming in.
When we're talking about changes in bowels or urine, what are we saying here,
So from the saying, if you're...
Or like a list over here.
These things should be talked about. So, if your bowel habit is to go once a day, and now you're going 2 or 3 times a day.
Right.
Or you used to go once a day, now you go once every 4 days. Any changes like that, or you notice blood in your stools, those sort of things. With the urine, for example, you're starting to get up at night more, you're peeing more often, it's harder to pee. Those sort of things are very important to actually identify early and having those conversations with your healthcare professionals and actually getting on top of any problems early. Because if you catch all of these things early, they're easily treatable.
Yeah.
And then we can get on top of them early and actually keep your quality of life. And as you age well, and the quality of life goes with it.
That's very interesting.
So but I think having that relationship, having that sort of bond with your healthcare professional helps.
Yeah.
And then because we know our patients what's normal for them and what's not normal for them, because we've got time to get to know them properly and see them face to face in their own homes. So I think that really helps as well, and it gives them a bit of trust in someone, and actually they find it easier to confide in someone, and so actually those sort of things help to maintain your wellness overall and actually keep your maintain your high quality of life.
That's super interesting, and kind of what I'm hearing there is that you've got a few different buckets there.
Yes.
You've got the kind of monitoring piece that you do yourself, and you're saying, well, actually, have I got any changes in any things that happen? Any bodily fluids?
Absolutely, yeah.
You've got the things like your analysis on data, so cholesterol levels, blood pressure. I've read some stuff saying that all-cause mortality reduces by just having lower blood pressure, which I think is really interesting. And we spoke about some glucose earlier, which we'll come back to, I think, because that's a really whole interesting piece that's kind of become a very interesting, popular discussion all over. But one of the things I wanted to also ask you about is exercise and muscle mass and the impact that has on dementia and so on. I was reading this study recently on the hang test, and talking about, well, if you can hang for longer, you are less likely to get Alzheimer's and dementia. And one of the reasons for that is effectively muscle mass, because how do you hang longer? By building muscle mass.
Absolutely.
How do you build muscle mass? You're lifting heavy weights.
Yeah.
So what's your take and thoughts on that?
It's to do with sort of nutrients and wellness, really.
Yeah.
So if you've got good muscle mass, it means your well-being is maintained. You're eating well, you're having the nutrients in, and keeping it going. So a lot of things with Alzheimer's and dementia and cognitive function is linked to lack of nutrients in your body, lacking of fatty acids, lacking of muscle mass. Just these things are needed for the body to fight and recover anything it's doing.
Yeah.
So that's why it's really important to keep that cardiovascular side of your exercise things up, keeping your muscle mass up in your earlier days to allow you to fight off things. So, even if you think when you're ill, you actually start losing you get weaker. If you've really got a flu or you've had COVID or whatever, your muscle mass goes down because the body is using those nutrients to fight off the illness. But if you haven't got that in the first place, it takes much longer for the body to recover, and the effects of the illness is much more. So all of those things are really important, and especially with muscle mass and sort of exercise as well. It's the mental well-being as well. So if you're mentally feeling better, you're more likely to take care of your health in terms of eat better, feel better, and actually do those sort of things. Look, a lot of the time as people get older, they start lacking the motivation to even eat. And so they probably do find in some of your home care clients that actually they really need to be almost encouraged to eat. And it's all linked together. So with emotional well-being, physical well-being, and mental well-being as well, and they all play their part in it.
Yeah, that's really interesting. And I think, one of the things I was reading, I don't know if you've read Peter Attia's Outlive. It's great. Yeah, it's a great book, and one of the things I was reading in it was, and which really kind of hit home to me was, your muscle mass starts to decrease at a faster rate after age 45 or something, is it? And you think, well, okay, if I just want to be able to tie my shoelaces at 80, how much muscle mass is that going to take? And therefore, what do I need to be, how high does my muscle mass need to be today so that I can kind of stave off that, or whether I want to play golf or play my grandchildren or whatever it is. I mean, what is the muscle mass that's going to be required then, and how much more do I need now as a result of that?
It's very difficult to tell. Is the thing. It's very difficult to tell how your body will go in the future, or how it will react in the future. All you can do is maintain it now, and the more you can maintain things now, the likelihood of things declining in the future is less. So making sure you're eating properly, making sure your weight's at your BMI at a healthy balance, making sure all your nutrients are in, making sure you're exercising, making sure all those things. So the more you do now, and then once it's sort of a habit in yourself, you're more likely to carry it on as well. But there's no real way to sort of tell how much I exactly need now for 10 years' time. Because if your lifestyle changes in those 10 years, that will affect what happens in the future. So if you're working out now every day, but then you suddenly stop now, how will you be in 10 years is different to if you carry on now in the next 10 years. So the main thing is getting the right habits in your 50s and your 60s or your 40s to then keep going and having a higher quality of life in your 70s, 80s and 90s.
That's very nicely put. Thank you for that. And when we're talking about glucose levels,
yes,
that's something that I find really interesting. I started intermittent fasting actually about 6 months ago, which has been, I have found that I feel more switched on, and I feel less kind of, groggy in the mornings and all that kind of thing. I do have all of the Zoe kit. Haven't got any with it yet. I will. My wife keeps saying, "What the hell? Just go and go. You can't get it done." So I will. But what's your kind of take on all of that? I mean, there's a lot of really interesting studies out there, Dr. Millie Peltz and so on. But what's your kind of general take on it?
I think and then we're finding more and more about these things. So there's more research going into it. But I think intermittent fasting is really good in the sense when you're intermittent fasting, your body's looking for energy sources.
Yeah.
So when most of the time in our body, there's cell reactions happening all the time. There's some that are going correctly, some that are not going so correctly. So with intermittent fasting, actually what happens is those sort of processes that aren't going very well get taken up first because they're the ones that are taking up more of the energy. So actually it's a way to cleanse your body. So not every single day, because you want to shock your body into it maybe once or twice a week type of thing. And actually what happens is it takes away the free radicals. It takes away sort of all the sort of the process that may not be going quite right. So things like, cancers, for example. A cancer is a normal cell that behaves abnormally. That's all cancer is. So with intermittent fasting and things, you're sort of almost using up the supply of those abnormal cells first. And that makes you feel fresher because your body gets rejuvenated. We don't need to eat the amount of calories we eat now is not really what we need. Hence, there's a massive obesity crisis, a massive sugar crisis because of that reason. So I think that intermittent fasting, we're finding more and more about it, and it is really good for your sort of brain cognition and focus as well, as you found out yourself. I do it sort of a couple of times a week.
Yeah.
And sort of make sure you eat in an 8-hour window, and the rest is a fasting bit, and it works really well. And I feel actually better. I feel more energized with it, and more sharp and more focused. I've been doing it for the last probably 12, 14 month.
Yeah. No.
And I've been doing it, so my wife's kind of seen it as well, and now she's involved in it as well. So kind of, it's a habit that kind of, it will spread because people will see the benefit of it, and then they kind of get involved as well. So once it gets part of your normal lifestyle, it actually doesn't feel as a big thing anymore.
And tell me, so I found that my cravings have reduced as a result of it. So I'm a bit of a chocolate fiend. Yeah, I do love me a bit of sugar, but I found that I don't have those kind of urges in the same way. And I wonder if that's as a result of this and like sort of steadying out glucose levels, or is that in my head?
It's difficult really because so we all know what chocolate does, what ice cream does, what fatty food do, and it's a case of making choices, right? But when you're feeling better, you're a bit more focused, a bit energized. You think, actually, perhaps I don't need this anymore because I value how good I'm feeling with having this fasting period. So I think that sort of changes the habits as well. But when if you feel more motivated, more sharp, more clarity, you'll find you'll make better choices. So if people that are low in mood, so for example, you'll see them binging out on crisps and chocolates and fried food or whatever. And it's not that they don't know this isn't the best thing for them, but it's that sort of focus, the mental clarity, the motivation, the mood, all those things play a part in it. So I suspect there's a mixture of things why that happens, but I think a lot of it's to do with how well you're feeling yourself. And actually having this possibly is not the best thing for me to have at the moment. And sort of cutting those cravings down.
That's super interesting. So if you had with all of that in mind, and possibly some others, I mean, if you had your top 3 things that you would say to someone in their 50s who maybe isn't, in the state health-wise that they want to be, maybe they're overweight, maybe they're finding kind of the motivation piece difficult and all that. And also they're kind of looking at this long-term trajectory and thinking, gosh, I want to change my life.
Yeah.
What are the top 3 or 5 things that they ought to be doing? When it might be a combination of some of the stuff that you've said here, might be some other things, but what do you think? What else could they be doing?
I think certainly having an annual health screening, I think is very important. It gives you a base to start from.
Right.
It'll identify if there are any problems or if there are any problems coming. I think that's probably one thing. Second thing is looking at your lifestyle, looking at your diet, looking at the physical activity, the job. Third thing I think is the mood, the mental well-being. Because if that's not right, so you can't do the rest of it. Because that's a really crucial thing that people miss. Most of the time we focus on symptoms rather than actually the cause of the symptoms. All right. So I think that's one of the things as well. And actually nutrients and supplements. there's certain supplements that are needed more for certain individuals depending on their health needs. So I think that sort of focused talk with your doctor helps as well. But I think the start for this sort of thing is your sort of like an annual check, to catch up with your doctor, a face-to-face appointment, a frank discussion about where things are going, where your problems are, what are you having problems with, and what are you looking to do. And then you can sort of customize it and personalize it to each person.
Great, amazing. Thank you so much. I think I feel ready for my well-made check. I might come and see you actually.
It works.
So how do people get in touch with you, and a little bit about what you guys specifically do that helps in this whole arena?
Yeah, sure. So I think one of the things we help with is we offer in-house service. So we come and see you in your own environment rather than you having to come to see us. So we do sort of annual checks on our patients. So we see that at least once a year, check everything over, make sure the tablets that they're on are the right one, make sure the blood pressure, cholesterol, their sugars, everything is okay. If they need anything in terms of they trying to access healthcare. So there's a big problem at the moment is trying to just get through to a doctor. Surgeries are closed, we're fully booked by 8:30. It's that game at 8 o'clock in the morning, you're on the phone for an hour. And you get through at 9, sorry, there's no appointment. So I think we sort of have made access much easier, because I think especially
a lot of our clients have really enjoyed that access as well.
Yeah. But I think especially the home care clients that that are elderly, they may not find it as easy to get on the phone and get in the queue at 8 o'clock. So they've got access to us very easily, and we'll go and see you and sort of identify any problems early, and they get to know us. So we have quite a strong relationship with our clients. So they get to know us, and they can confide in us and sort of tell us about problems early on. And actually that helps with their well-being and their motivation and emotional health as well.
Yeah.
And then we also sort of, so one of the things we do is sort of vitamins and supplements and nutrients for them. And we sort of make bespoke brand, sort of bespoke packages to meet their needs.
Well, that's what do blood tests and so on?
Yes, we do blood tests and there's things like, if there's a family history of Alzheimer's disease or dementia, or there's certain genetic predispositions that they may have, we sort of target those areas and sort of get the supplementation with it, just to make sure those levels of things are kept up.
Yeah.
So it's all personalised. So because not everyone is the same, so you have to make sure what you're doing is first of all right for your patient or your client. And secondly, that they will do it. There's no point in, if you look at research, the amount of medication that's given that isn't actually taken by the patient. And there's a reason for that, because not everyone fits the same bill. So I think having a personalised sort of a healthcare plan for each patient really helps.
Great, thank you very much. And
come down.
I usually end this with, getting one actionable piece of advice that our listeners can take to grow their business to towards that £1 million and beyond. And I wonder if there is something that you find, whether it's meditation, exercise, or whatever, it's something from your side that you think, well, this is the thing that will help you with your productivity to build your business and build your health and wellness.
I think taking ownership, for me is the first thing. Once you start to take ownership of any problem you have, and you actually own the problem, then you can find a solution for it.
I love that.
So I think rather than, it's very easy, as entrepreneurs, we work long hours, whatever, and it's very easy sometimes to bury your head in the sand. But actually, getting on top of it, rising above it, taking ownership of something, and actually that's the way to find the solution. Everything's got a solution. And that's the way I see it. Whatever your problem you have in your business, whatever you're doing, there's always a solution for it. Own that problem to find the solution.
Thank you very much, Randeep. What a pleasure. Thank you. Thank you for joining us.
Of course. Thank you so much.
And that's it. That's a wrap. We've had Dr. Randeep Bhella, and just phenomenal. There's your hacks to age well. I hope you've enjoyed it. I'm certainly going to go and make some notes and take some ownership.